Hey guys, it's Jen again. If you haven't checked out my intro video for this channel, please go back and watch it just so you know what to expect. For my first video, that's not the intro, I wanted to do kind of a story time as well, sort of an advice video on going into your first anatomy dissection, your first year of medical school. So our school has an anatomical gift program, of which we are very blessed to have, which means that people can choose to donate their bodies when they eventually pass. So how it works is we have about 6 to 7 students assigned to one cadaver, and there's a kind of a three-part rotation where every third rotation is when you and your partner would dissect. That way it's distributed evenly and everyone gets their fair share of experience, but it's also not overwhelming. And we dissect throughout the year. They try to correlate it with the theme that we are studying lecture-wise. So we start in the second theme of medical school. It's called musculoskeletal, and we basically are dissecting the upper limbs and the lower limbs in that two-part theme. And I remember for the first dissection, which I actually had with my partner, and we were dissecting the just the chest area going down to the muscles, we were really over-prepared for it, actually, because the school, and they have good reason to want to over-prepare us for that first experience especially. They really try to make us go through any possible situation that could happen, fainting, feeling sick, feeling almost disgusted that we have to, cut someone open that could be our grandparent in appearance. It can be overwhelming. And because we were so over-prepared, I think everyone found a way to deal with it. For me, the way I dealt with it was just detaching myself from the emotional aspect of it. So when I went there, it was to dissect a cadaver. It wasn't to dissect that person. And not everybody needed to deal with it in this way, and others dealt with it by making jokes, by, just embracing different aspects of it that were the least stressful. I think by the end, everyone got used to it. Yes, it's absolutely gross. It smells. It, by the end, is moldy, just full of the juices of the spray bottle that you have to spray on it. That's antifungal, anti-whatever. But you learn so much by dissecting an actual human body compared to the virtual reality that another school might have to use instead. So very lucky, so thankful. So I will actually be attending a memorial service in a few weeks to honor the people who donated their bodies for us to dissect. And for the specific person that we were able to dissect, in your group, the family of that person will be there. And we get to interact with them. They can ask us questions. We can inquire more, perhaps, about that person's life. And more importantly, we can thank them profusely for the gift of their loved one. You learn so much by doing something in person, by getting to see the many, many differences between human bodies, because we have about 20 or so cadavers in the dissecting room. It's amazing, and I feel extremely prepared for, in that future day when I would be perhaps helping a surgery, in third year, or just being able to imagine what the structural setup is of the human nerves or blood vessels when you're learning about a clinical correlation. I can actually remember that dissection and remember exactly what I saw versus having to look up an image because you've never dissected before. So once again, very, very thankful. It's a great experience. Yeah, it's gross, but it's worth it. All right, and I have some tips for you if you're going to be dissecting a human body for the first time. The first would be dealing with the smell. It is pretty gross, especially by the end. So I would take Vicks VapoRub or something that smells very strong but good, and rub it under your nose before you go in. because that will be the dominating smell during your how many ever hours you're there, and you won't be overwhelmed by chemical smell or just decay. Another tip would be to chew gum. Yeah, I know it sounds gross to chew gum while you're dissecting a body, but so many students ended up doing that, and I think that helped because you taste and smell the gum, not what's around you. Another tip would be you're gonna possibly end up dreading going into anatomy lab because you have to change, you get messy, it smells, but the thing is, if you look at it from a negative perspective, you will avoid going in, and then the week before the exam, you will be so underprepared that you'll have to go in like every day. And you want to be studying for the written portion of the exam. You don't want to be worrying about the anatomy. So what I say is, instead of dreading it, actually go the opposite direction and attack it. This is what I did, find a small group of people. I had 2 other friends, and we, by chance, each had a different rotation of the dissection, so it was perfect. For example, this is how it worked. After I would dissect on a Monday, let's say, on Tuesday, which was the off day for dissections, all 3 of us would put on the scrubs, put on the equipment, go into the lab, and I would teach them my dissection. Then Wednesday would come around, the second person in my group would dissect, and then on Thursday, all 3 of us would go back in, and we would be taught that person's dissection, and it cycled like that. And because we kept reviewing, by the end, we were so prepared that we only need to go in, once the week before the exam. So attack it, don't dread it. Another tip would be to fully utilize the professors you have at hand. They'll be there while you're dissecting, but give them a week's notice, send them an email asking to meet privately in your small group or even just one-on-one, and come with a list of the types of, whether it's the nerves, blood vessels, whatever you need to know, that maybe you have the hardest time identifying on a human body. And kind of drill them with that and have them show you what they use, the tricks they use to find different nerves, different anything. Take advantage of that. It's very helpful. And then the last thing I would say is for your hands, you'll be given kind of like dishwashing gloves. That's what I would compare them to. And they can get really gross too. By the end, it will smell inside. It might even be growing, because of the smell, it might even be growing fungus, causing a smell. So what I would recommend are 2 things. 1, buy some antifungal powder, pour it in throughout the year. But also, if you have access to disposable gloves, or even if you can just buy them, put them on your hands first and then put your hands in the gloves so that your hands themselves never get that disgusting smell. I wish I had done that, but I didn't until the last month, and yeah, my hands smelled really badly from every day I went in, so don't make my mistake. Alright, well, that's all I have for you today. If you'd like to hear more, please let me know in the comments. Let me know what you think. Again, I'm open to anything. I really want to give you guys what you want, not just talk about what I want. So let me know, and I look forward to seeing you in the next video.